Hello and welcome. I'm Jacob. I'm one of the second year surgical residents.
I'm Stephanie. I'm one of the research residents.
I'm Leah, I'm one of the fourth year residents.
We're sorry you can't be here, but unfortunately COVID's still going on. But we wanted to create a small video just to show you what our facility looks like and to just talk about a few things. So let's get started. Hey Chris. Hey Jake. So this is one of our main call rooms. It actually just got renovated thanks to Allison and Yolanda's help. So we have about 10 computers in here. Basically in the morning everyone comes in, looks up their patients, and this is just an area where we spend most of our day when we're not in the operating room or taking care of patients on the floor. Just to point out a few things, we have a major monitor which we use for conference sometimes because sometimes we are on Zoom. We're transitioning mostly in person, and then we have our lab trainer over here, which we're all very competitive, so we're trying to beat one another. I will say, you just gotta follow me over. So that was just one of our rooms. It was our biggest one, but we do have other rooms that we have, like a bunch of different surgical teams. So each room sometimes, or each team sometimes has its own room that they meet in. As you can see, every resident gets a locker just to place their stuff in the morning. These residents are dressed up because they're going to a special dinner. Hey Tyler, how are you?
Hey, buddy.
Hi, Tyler.
What?
Our original small call room we have upgraded. That being said, we still spend a lot of time in this room. There's a very nice view, I will say, is the surgical residence. We did luck out and get the nicest view in the hospital. Additionally, I convinced the kitchen staff to get us snacks every single day. It took a lot of convincing, but we have chips supplied every day, muffins, and we have our own fridge, which normally is stacked. I convinced them that we needed cheese sticks and PB&J, so you'll never go hungry. As I said, we have a bunch of small rooms that each surgical team sometimes will use during the day just to run the list, talk about patients specifically. So if you come on in, we have people clean it every day, I promise. 2 computers and a bed. When you're on call and it's 2 a.m. in the morning, there's plenty of beds. This is my favorite one, I have to say. And don't worry. They changed the sheets as well.
I'm very impressed.
So I have to put my mask back on because we're actually going to go into the SICU. So follow us. So in general, there's about 14 beds in the ICU. We share it between trauma patients and our general surgery or critically ill vascular patients. So front desk, basically there's everything you need in surgical ICU. There's multiple supply room closets that we can pull anything for. We have a really good relationship with our respiratory therapist that we can call at any hour of the night to help with the ventilator. They're very good for an educational standpoint as well. Just today I was getting a lecture from one of the respiratory therapists who was teaching me a lot about vents. So if you want to just take a look, come down here. So this is one of our empty beds right now. Very large room, and actually all the rooms do have a nice view, which the families do like. Bed, monitors, Hoyer lifts for all our patients that need help, crash carts, brand new TVs, brand new monitors, and like I said before, very nice view. If you come with me this way, nice relationship with our nurses. This is more talking with a few of our, with Steph and Leah. Put my mask on, we're going to the operating room. So it follows here. Basically, this is like the hallway before you actually go into the operating rooms. Come on this way. So over here we have basically our vascular and one of our CT rooms. It's a hybrid room, so basically all of our vascular surgery surgeons operate out of these two rooms, just so that we can do fluoro and basically do all our endovascular procedures. I apologize. It's very. Let's see if you can. So recently, we actually just had one of the vendors change out our scrubs. So basically, you just swipe your card onto the machine, and it automatically gives you scrubs. And then if you follow us down further, and when you're done with your scrubs at the end of the day, you just swipe again, throw them in, and it gives you credits again. So pretty nice. They'll wash everything for you so that when you get blood on yourself or coffee in the morning, you can just throw them in and they'll fix it for you. All right, one of the newer areas of the hospital, the heart pavilion. Most of our patients we have in this area. It's really nice, big rooms, and the nursing staff is very fit to take care of like what we call our step-down patients. So I'll take you in a sec. We also have patients in the other areas of the hospital. A lot of times those are just consults and like small, like what we thought were same-day surgery patients. So let's go take a look real quick.
You text.
Oh, empty. Perfect. So what I'm about to show you is one of the rooms we have in the hospital. Here, there are no double rooms, no patient share rooms. Everyone gets their own room. These are very big rooms. Families are going to be very happy with the accommodations. So let's go in real quick. So this is a not done up room, I guess you would say, but overall, big room, monitors, really big windows, and then also very nice bathrooms that the patients always ask us if they can shower. I would say that the majority, probably 80% of our patients are in these types of rooms. And as I said earlier, we do have patients elsewhere in the hospital, but they're normally consults or patients that come in with a gallbladder or appendicitis and just need to stay the night after their operation. So this is one of our thoracic surgery attendings, Dr. Ibrahim. Say hi, Dr. Ibrahim.
Hello. Good luck. Welcome to Lincoln.
So here we have the APC, the Ambulatory Procedure Center. Basically, it's just our same-day surgery center where we have a lot of quick, easy procedures. The turnover time is really quick, and our surgeons really like operating out of here, just because come in early, operate, they get to go home. So we'll do our best to show you in here.
It's also where our attendings, our colorectal attendings, will do their colonoscopies down here in the endo suite, which is right next to the same-day surgery ORs.
So we can't show you too much, but come on quickly. Pre-op for all the same-day surgeries. And then over here, if you go down further in the hallway, you'll get all the operating rooms. It's kind of quiet now and it's 5 o'clock, so everyone likes to work here because you get out early.
Yeah.
So now I'm going to take you to one of the main areas that our surgeons have their outpatient offices and where they see their patients. So Steph will take us in. It's later in the day, so I don't think anyone will really be here right now, but so next, we're going to show you our where most of our surgeons have their outpatient offices. That being said, we're going to try to convince Dr. Geffen to say hello, who's our assistant program director. He's a little shy sometimes, so you've been warned.
Okay, let's see if he's there. Okay, we're gonna see if Dr. Geffen wants to say hi. Hi, Dr. Geffen. Do you want to say hi to our applicants?
Sure.
This is
Hey,
Dr.
guys.
Geffen. He's very excited to meet all of you.
Very excited. All right, well, I'll see you guys in interviews. Good luck.
We'll let him get back to work. Bye. So this is one of the exam rooms in the clinic that they just redid all of this, so everything's brand new. Oh my god, I can't even believe you asked to be on there.
Yeah.
That's like so
What'd you say?
I have everyone else too.
So next, this is just where we get our coffee in the morning. Not a huge fan of the cafeteria coffee, that's just a personal preference. So I have my girls and Coffee Bean over here hook me up every morning. And you can get bagels and pretzels too. It's closed right now because it's kind of late, but good to see. Ready. So next, I'm going to take you down to the cafeteria. I'd say in general, we really do have a nice cafeteria. It's open pretty much like 24/7, which is really nice when you're on night shift, which we'll talk about later. I would say every day there's a sandwich bar, which you can get whatever you want. Have froyo at all hours of the night, sushi at all times, and there's a few like different things where you can get hot meals every day. There's also a barbecue every day, more so hamburgers, hot dogs, and then we have different vendors come in, such as Coyote Crossing, an Italian restaurant, and halal. There's a bunch of other ones as well, but they switch it up pretty much every day for us, which is super nice. We have a special guest here in the cafeteria. This is Sammy. He's one of our urology residents. During the first year, we have 2 urology residents that rotate with us for 9 months, and then they get 3 months of urology. So he's one of our favorites, and we get to call him when we need help in the OR.
Yeah, we have a lot of fun together. It's a good time. Highly recommend.
Next, I'm going to show you where our sim lab is located. We use it a bunch for different things, especially for the first and second year residents, teaching them basics such as chest tube placements, central line placements, and we actually have reps that will come in and spend 2 hours with us when we have protected time. Recently we had, I think Ethicon came in and we did we sewed on pig intestines, we did some small bowel anastomosis. We also had Stryker, who's our vendor for all our supplies, and we used different like bovies, we used the ligature, and it was just really cool to be able to take some time to do that. So I'll show you kind of what's all. So this is where we do orientation for anyone that ends up coming here a few weeks before. You'll come here and we'll kind of give you the lowdown of the place again. Like I said before, we kind of just start off with lectures in here from different vendors before we start different sim lab. Unfortunately, I don't have a lot of things set up at this point, but we do stuff on chest tubes, placing drop-offs, central lines. I don't want to open up these big things, but they basically just have practice dummies for all the things I mentioned. And then if you come back here, I'm not gonna lie, we don't normally use the mannequins. It's more for the internal medicine residents going over certain situations and simulations, and we don't really do that much. But that being said, what we normally use this area for is when the reps come in, they place different bunch of stations, and we just kind of between ourselves kind of teach one another. So going down this hallway, just a few of the rooms. Our emergency department, I think, has like 50 plus beds, all state of the art. They have everything you need. A lot of the patients do come here over other places because they like the emergency department. I have had them tell me that a few times. So now we're in our trauma bay. We have 3 different bays. There's 2 other ones to my left. And recently we became a level 2 trauma. And Stephanie's going to talk a little bit more about what facilities and things we have in the trauma bay.
Yeah, so each trauma bay can technically be turned into an operating room. We get a relatively good amount of penetrating trauma since we're right next to West Philadelphia. The mid-levels and senior residents get a lot of time doing like emergency procedures down here during all the traumas.